Welcome.
Excuse me, Saji. I think you're lagging a bit.
Hello.
Yep, we can hear you now.
Oh, sorry, I was breaking at which part?
Maybe you could start over.
Very good. Hi, am I still lagging? Hello?
Yeah, it's fine now.
Okay, I don't know what happened. It was okay during the test run. Okay, anyways, let's just proceed. Okay, so welcome to the webinar. The title is on the re-emergence of rabies, posing a transnational threat to public health. So before we kick off, I would like to extend sincere gratitude to MYOHUN, which stands for Malaysia One Health University Network, and the One Health students of UCAM for helping us to the results. So we're preparing this focus now, and I'm so glad to see that although we have 72 registered participants, I hope that the number will increase as we go on. So again, thank you for joining us. Now, do allow me to share my screen. All right. Okay, so a few housekeeping rules I would like to go over for the speakers. We will be timing you so that you will present smoothly within the time given. At the 10 minutes and 5 minutes interval, our timekeeper will personally send you a chat over WebEx. All right. So as for our participants here, please make sure you're muted. And again, just now there was a lagging problem. If you can, please turn off your webcams to avoid any interruption. If you have any questions, please type them in the chat box. Do make it public so everyone can have a look at it as well. So the speakers will answer your question if time allows, or else we'll try our best to relay the questions to them during the Q&A session. And last, there will be a QR code at the end of the webinar. Feel free to scan it if you require an e-certificate. So, okay, so before we proceed with this part, I would like to invite the president of ISOHA, Andres Papas, to say a few words. So I'm handing this over to Andres. Thank you.
Hello, good morning. Good morning. AM, so it's too early for me. So I'm a vet from Greece, as you already said, and I'm the president of International International Student One Health. I want to tell you just a few things about One Health and what One Health is. So One Health is the common health of animals, humans, and their shared environment. So today, you're called to come here and learn a few things about rabies. So in the One Health idea, we have two things that we need so we can learn more about and we can solve our One Health different issues. So the two things that we need is, the first is education and the other one is connection. So today here you do the first step. You come and you learn, you educate yourself about rabies in this current time. And rabies is a very nice zoonotic disease that it covers all of the topics that of the multidisciplinary collaborations, and you can learn how this transmission between humans and animals and wildlife is connected. So you will learn many different perspectives today. This is the first step that you're doing today, but the second one is to connect even more with people in your country, with other students, with around the world about other One Health issues. So I call you to follow ISOHA websites and social media so you can learn even more things about One Health and be part of interdisciplinary collaborations worldwide. So thank you very much for calling me here. Congratulations for this event. I will not be able to participate in the whole event, but because it's too early for me, but I will try my best to be the biggest part of that. Thank you very much.
Thank you for your kind words, Andres. And sorry about the time difference and all the confusion involved. All right, so to proceed back, I would like to introduce you to the person who made all of this possible. None of us would be here today if Prof. Latifah hadn't graciously invited the speakers. So now, who is Professor Dr. Latifah? She is a veterinary public health epidemiologist and academician at the Faculty of Veterinary Medicine, University Putra, Malaysia. She has been regularly invited to speak at national and international seminars and conferences. Currently, she is the coordinator of MYOHUN and head of the Department of Veterinary Laboratory Diagnostics in UPM. Now, let's give a warm welcome to a few words.
Excuse me, Prof. You're muted.
I'm sorry. Okay, so that always happens. Thank you again for inviting me, and thank you, Saji, for the kind introduction. I did not know that you're going to show my recent publication there, but thank you for that. Again, Assalamualaikum, and a very good morning to everyone tuning in. Welcome to the webinar organized by the IVSA and One Health Student Club under the guidance of Malaysia One Health University Network. Congratulations to the IVSA and One Health Student Club for pulling this seminar, webinar together in such a short notice. It's pretty amazing what you guys can do within like a week or so, 2 weeks if you include the time by which we have to invite the speakers. I'm sure there's more participants coming in, so hopefully they'll come in. It's a little bit hard. It's the weekend, it's Saturday, so people sometimes, they want to wake up late and things like that, but that's okay. Thank you for joining us. A little bit about MYOHUN. For those who are not familiar, MYOHUN is a network of 17 universities in Malaysia, along with a few government agencies that place lots of efforts in emphasizing One Health concept in managing emerging diseases through various trainings for our students. So One Health Student Club is the baby of MYOHUN, member universities, and it's one of the effort by which we try to instill One Health competencies among future leaders. So if you are students, definitely you are our future leaders. So we want to make sure that at least a proportion of you will be introduced or are familiar with the One Health concept. With One Health, there's a lot of focus on transdisciplinary and intersectoral collaboration and partnership towards a common goal. The idea is that complex One Health issues such as rabies, by which we'll be talking today, that spur as a result of animal environment human interconnectivity cannot be detected, controlled, or managed by a single institution. So everybody has to work together to come to a holistic kind kind of solution. Dr. Katinka from FAO will probably give you an overarching overview of the rabies in the region. So thank you very much, Dr. Katinka, for being here today. Prof. Razita, my very good friend from UNIMAS, she's a public health specialist. And she probably will give you the public health angle and implication and epidemiology of rabies, especially what's going on in Sarawak at this time. And we also have Dr. Stephen. He's the Deputy Director of Veterinary Services from Sarawak. He will probably give us an insight into what is truly happening in the field with the rabies in Sarawak. No doubt, rabies is probably one of the most terrifying and diabolical diseases out there. Right now, we are so immersed and overwhelmed with what's happening with COVID-19 that sometimes other zoonotic diseases or emerging zoonoses have to take a back seat. But rabies is right out there in the background, happening along with COVID-19. So about 60,000 annual cases of rabies is reported worldwide, and half of that is actually in Asia. So we are truly a hotspot for rabies, and definitely we need to be talking about a concerted effort in managing the disease. I don't want to take too much of your time. I thank you again, all speakers, for being here today. This is a Saturday. Appreciate your time so much. And I thank everyone for their participation. Please enjoy the webinar, and I hope we have lots of questions and a truly interactive session during the Q&A session. Thank you. And over back to you, Saji.
Thank you, Prof. Al, for the kind words and also for sharing with us the rundown on rabies. So to continue where I left off, now I would like to introduce our first speaker for today, which is Dr. Katinka di Balogh. She has held positions at the World Health Organization and worked as a lecturer at the veterinary faculties in Zambia, Mozambique, and the Netherlands. So over the last 16 years, Dr. Katinka has been working for the Food and Agriculture Organization at its headquarters in Rome, Italy, and she holds the position of Senior Animal Health and Production Officer at the FAO Regional Office for Asia and the Pacific based in Bangkok, Thailand. She is also the focal point for the FAO, OIE, and WHO tripartite regional collaboration, as well as for antimicrobial resistance and rabies. Without further ado, I'm pretty sure everyone's pretty excited for this. I am too. So if Dr. Katinka, if you may, the floor is all yours.
Thank you very much, Sajida, for this very kind introduction, and good morning to all of you. And from Greece, very Kalimera. I think it's very early for you in Greece at the moment, but it's really lovely to be here, and thank you for this invitation, Dr. Latifa. I was very excited when I received your letter. And I think it's excellent to see the engagement of students in this very important topic. I'm not sure if my connection will be very good here from home, so please interrupt me anytime if there are any issues with the connection. And thank you very much for passing the slides for me, so just to make sure that you are able to see them properly. So thank you for the topic, to give you an update on the global and regional situation, as well as the strategies on rabies. Next slide, please. I'm currently in the transition moving back to Rome, but I've been 5 years now in the region, in the Asia Pacific region. And just to give you a little background, just a few slides on FAO, on the Food and Agriculture Organization of the United Nations, because we have been working very closely with the World Organization for Animal Health, or the OIE, as well as with the World Health Organization. And especially here in the region, we have 2 offices. One is the Sierra office in New Delhi for South and East Asia, as well as the WIPRO office, which is based in Manila, which is catering for the Western Pacific. So the mandate of FAO is to build a world without hunger. And we have 195 member countries, and we have direct contacts with the ministers of agriculture who meet every 2 years in Rome to define the work of FAO. Next slide, please. If we look further at the office of FAO, we have here the office for Asia and the Pacific, based in Bangkok, in Thailand, and the headquarters of FAO are in Rome. And there are several regional offices, but this one is the largest in the world. Next one, please. And if we see the region that we cover from the Bangkok office, it actually covers from Iran up to Samoa. So there are 46 countries that we cater for. So from Mongolia down all the way up to Australia. So you can see it's a very large region, and it's also the most diverse region in the world, not only culturally, but politically, geographically. And also if we look at different animal health production systems, it's very diverse. Next one, please. As all the UN organizations, we are very much committed to the Sustainable Development Goals. And while FAO mainly deals with SDG 1 and 2 that relate to no more poverty and also eliminating hunger, we also have a large contribution to SDG 3, which is better health. And here clearly the work on rabies very much falls into this category. Next one, please. And we see that now there are new opportunities, if we can clearly link to the SDGs, that how we can ensure that rabies contributes, or the elimination of rabies contributes to this. And within SDG 3, there is also one of the indicators is the elimination of neglected tropical diseases, where also rabies falls under as a neglected zoonotic disease. So we know that still rabies, unfortunately, is present in around 150 countries around the world, and tens of thousands, it's 60,000 people die every year from rabies. But we need to realize that this is a completely preventable disease. And it's a disease that also, on the other hand, is 100% fatal. So once the clinical symptoms appear, people will die of a horrific disease. And I think this realization, and we have all the tools to control this disease. Every human case is one that could have been prevented. So we need to make very much sure that we join efforts and eliminate dog-transmitted human rabies. So as mentioned also by Dr. Latifa, Asia is one of the areas, together with Africa, where most of the human cases are found. And we find that in Asia, most cases occur from the transmission from dog bites. Next one, please. So we see that the efforts very much need to be focused on the vaccination of dogs. And here you see the map with the global animal rabies reported. And we know that rabies is very much an underreported disease in many countries. But from the light blue, you see where dog rabies plays a major role. So not like in Russia and also in Eastern Europe and Central Asia, where we have wildlife playing a role, especially foxes and wolves. But in Latin America, we see that here the vampire bats play an important role. But while in South and Southeast Asia, it is the dog, I think we can focus much more our efforts on dog vaccination and everything that is linked to that. Next slide, please. So from the next slide, just to indicate some numbers, as mentioned already, it's 100% preventable disease, and 99% of the cases occur from dog bites. And about every 15 minutes, still somebody dies of this horrific disease. So if there are no bites, there will be no rabies. And if we are able to vaccinate about 70 to 80% of dogs, we will be able to eliminate the disease in these animals. And for the human health side, well, on the one hand, as mentioned, if we reduce the number of dog bites, but also we have a very important tool, which is post-exposure prophylaxis. So if people are able to receive the post-exposure treatment after dog bites in a timely manner and also finalize the course, in that way, we will be able to prevent the human rabies cases. Next slide, please. In the next slide, you will see that also some more figures with regard on the economics and the costs. And I will not go into detail, but we see that most of the money spent is for human post-exposure prophylaxis. And this is mostly spent by the ministries of health or ministries of public health. On the other hand, there is only a much lower number that is being spent on dog rabies vaccination. And if we see the cost, for example, post-exposure prophylaxis, the price of one PEP can vary between $30 till $150 or more for one single injection, while the dog vaccine costs around $1, and this is including the application. So clearly it becomes more cost effective if we are able to vaccinate sufficient dogs, and in order that humans do not need any more PEP, and this would have huge savings. But as you can see, this is two different ministries, and here the One Health comes in, that the close collaboration between the ministries of health and the ministries of agriculture is essential for developing the strategies and also the sharing of resources to combat this disease. Next one, please. So in the next slide, I just will give you a very brief historical overview. And here just to mention that rabies is a very old disease. There are descriptions already from Greek and Roman authors that mention this disease, but possibly it already existed much before. Most of the infections in Europe, after they managed to eliminate rabies in dogs, were later found in wolves and foxes, but also in livestock. And we find that often the numbers about livestock cases, the disease is not reported very, very consistently. And this makes it often very difficult also for the ministries of agriculture to justify putting the resources into rabies control. So really a game changer was when Louis Pasteur developed the rabies vaccine, because suddenly there was a very efficient tool to combat the disease. And this was initially the vaccine for animals, but also the vaccine for humans. Next slide, please. So if I take you further, I mentioned already the availability of quality vaccines. So on the one hand for human post-exposure, but also for dog rabies. And when in the 90s in Europe, they started to use the oral fox rabies vaccine, this managed to eliminate fox rabies in most of in the whole of western part of Europe, and now gradually also in central and eastern parts of Europe. Fox rabies is being controlled by oral vaccine. Currently, there is some research going on in Thailand on the use of oral rabies vaccine for dogs, and there are very promising results coming out. So this might be another way forward for vaccinating, especially dogs that are difficult to handle or free-roaming dogs that are not accessible for normal parenteral vaccination. So this is something to keep in mind. Furthermore, the legislation and the compliance to quarantine, compulsory vaccination, animal registration, these are all tools that also can help in reducing the disease. And interestingly, if you think of the COVID-19 situation currently, many of the interventions are actually coming from the animal health side, or that we as veterinarians are very familiar with, such as the quarantine. If you have importation of animals, they are always being quarantined for a specific period to ensure that they do not introduce diseases. Nowadays, in human medicine, they talk about herd immunity, but actually the word herd comes from animals, from cattle, from livestock, where we talk about herds, and having a sufficient high vaccination coverage. The same is for cross-border movements, and here the collaboration between countries is important. And normally for cross-border movement, you always will require vaccination certificates of dogs. And the big problem in Asia is where some of the borders are porous and there is no controls, that there is the possibility from dogs one side to another country on the other side. Responsible dog ownership, and I'm sure there will be more discussion on this, and this is another important game changer. Let me take you to the next slide, but also just to mention that you need long-term commitment and funding. Rabies is not a disease that you can eliminate in 1 or 2 years. You will need at least 4 or 5, depending on the situation, and sometimes 10 years to be able to eliminate the disease. Next slide, please. So if we see, just as an example, I want to use very briefly Latin America, where they have been, over a period of 20 years, been reaching a level where almost the disease is completely eliminated in dogs. There are only very few countries left that have dog rabies cases. But here we see what are the elements of success, and this has been very much in focusing on dog vaccinations, and here over 50 million dogs have been vaccinated every year on the continent. In addition, it has been learned that you have to vaccinate in a very short period. So here, most of these, for example, a country like Brazil organizes one-day national vaccination campaigns. And Brazil has, I think, if I'm not mistaken, about 200 million inhabitants. So they are able in one day to vaccinate large amount of animals. And clearly here, they mobilize the police, the military, teachers, nurses, and this is a real whole of society event. Next slide, please. In the map that I'm showing you, you will see over the years how gradually rabies became eliminated. So in this slide, you see the rapid decrease. And when you see an increase in dog cases, this is the blue line, then this will be followed by the red line, and this is in human cases. Initially, possibly the lower number in animal cases compared to the human cases is possibly due to lack of surveillance and reporting. In Latin America, as mentioned, they are still facing problems with bat rabies. And here we have the vampire bat, and clearly this needs a different approach, and this is very difficult to control. So this is the green line, are the human cases caused by bats. Next slide, please. So here is the map that I mentioned, where you will see the rapid decrease in animal rabies cases. I see the time is running very fast. Next slide, please. So you see there's only foci left, mostly in Bolivia and in Haiti. These are the 2 countries where still we have some cases. But we always see the difficulties start when a disease is almost gone, to get still the political commitment and the funding to go the last mile. Because suddenly the disease, you do not see many human cases anymore. There are less animal cases, and then often the interest to put resources in a disease to go the last mile to actually eliminate the disease, this is often difficult to get. And here is the big danger, that once you do not finalize to get really the complete elimination of the disease, you will get new cases arising, because the vaccination coverage over the years will dwindle, and this is the dangerous period. As mentioned before, rabies is very much a One Health model disease. While initially the concept of One Health was more developed with highly pathogenic avian influenza, so on looking towards emerging diseases, there was also the recognition that neglected diseases very much benefit from this One Health approach. Next slide, please. And in the next slide, I will show you the different components that the various sectors need to engage with. So we have certain activities that are very much linked to the human health sector, as for example, post-exposure prophylaxis, identification of dog bites, But then there are, like, for example, surveillance and good diagnostics are important in both sectors. So we have to have good laboratory capacity in the human health side as well as in the animal health side. Then there are also some cross-cutting issues, like, for example, community participation and public awareness. These are often where we see that both sectors work very closely, and also the involvement of municipalities and the communities. On the animal health side, we see, for example, dog population management as well as animal vaccination, and are the key areas where the animal health side engages. And I will later talk a little bit more about the integrated bite case management, where there is good collaboration between both sectors to identify at an early stage animals and people that have come in contact with the infection. Just one click, please, because here I just wanted to emphasize that all this is only possible if we have good legislation, political commitment, and funding available. Next slide, please. I think here it might be lacking behind. Okay, thank you. So in this slide, the stepwise approach towards rabies elimination, or the SARE, is an approach that we have developed as tripartite to address rabies. And I don't know, maybe the veterinary side is more familiar with the progressive control pathway. This is also where countries can see in which stage they are, and then there are very clear steps how they can move forward to reach the next phase or the next step. I will not go too much into this. This would be a complete separate lecture, but I've provided the link that you can use, and here you can find more about how to relate or more information on the SARE. Next slide, please. So just to mention here also, very importantly, in 2015, the tripartite, together with the Global Alliance for Rabies Control, they have come together to develop the jointed front United Against Rabies, and have determined 2030 as the goal to eliminate dog-transmitted human rabies globally. And this has given certainly an important push for countries on how to move forward. And I don't know, I see there is something in the chat. I don't know if you can hear me. I see there is a little bit some frozen, but anyway, I will continue. Next slide, please. And anyway, I will share all the slides with you, so you will receive this. Next one. So here, if we focus in Asia, as mentioned, there are many different cultures, and often dog keeping practices are very much linked to the culture prevailing in the country. There are competing priorities, and this is something to be conscious about, especially with COVID-19. We see that the health sector is very much involved nowadays, and many of the resources and also human and financial resources are very much committed to COVID and might be taken away from rabies control. Next slide. So if we go further and further focus in on Asia, in South Asia, I just wanted to mention a workshop that we had in 2019. And here we found that in South Asia, still in some countries, rabies is not a notifiable disease. And you can imagine if it's not a notifiable disease, it's very difficult to get sufficient information and to have also resources committed to this disease. Next slide. I see my time is running out. So next slide. In the next slide, I would focus on the Asian countries. And here we see that there is the need of good collaboration between ASEAN countries, because we see there are many shared borders between the various countries. And therefore it's important the collaboration as well as coordination. We find that currently rabies is endemic in most of the countries, and only Brunei and Singapore are currently without any rabies cases. In Malaysia, unfortunately, the disease has been introduced after having been free of the disease for a long time. And it's always very difficult once rabies has been introduced, so to actually eliminate. And I think we will hear from Sarawak all the efforts that are being undertaken. So next slide, please. So here, just to mention, the important part is that ASEAN actually has developed a rabies elimination strategy, or also called the ARES. And this was already started the development in 2010, but had also further been developed by 2012. And here Vietnam and Indonesia are the rabies lead countries for ASEAN. Initially, the target was established by ASEAN by 2020, but clearly currently this is being reviewed and being adapted to the 2030 elimination goal. I would like to mention the important meeting of the ASEAN Rabies meeting that took place in December 2018 in Hanoi. And during this meeting, next slide, I think it's taking a bit of time to come up. I don't know if there is an overall, okay, thank you. So here, one good thing is that rabies is a notifiable disease in all the ASEAN countries, but still to reach sufficient vaccination coverage, this is still one of the major challenges. And the countries are or have developed their national action plan for rabies, towards rabies elimination. And here it would also be good very much to work together. For example, Thailand has had a lot of progress in towards working towards rabies elimination, and maybe for countries to learn from each other. Also, Vietnam has had much efforts, and we all know Bali has been working very hard to also eliminate the disease that was only introduced in 2008 or 2009. Next slide. So if we further look into the ASEAN tripartite meeting that took place, here we see that clearly the improvement of the mass rabies vaccination is important, and there's some techniques how you can improve rabies vaccination coverage, and this is very much linked also to public awareness. And here to mention World Rabies Day, that is normally celebrated on the 28th of September, is a very important moment to create this overall awareness among professionals, among policymakers, but most importantly, among communities. Next slide. So if we come to community involvement, as mentioned before, dogs and humans, they live in close proximity. And for example, in many of the Buddhist countries, we see that there are community dogs that also not directly owned by any individual. It's the community that feeds them, but not often takes care of them. So identifying, for example, caretakers, people that are mostly feeding the dogs and that the dogs recognize, to have them involved in the mass rabies vaccination campaigns can be very important. So for them to bring the dogs or to handle the dogs. Next slide, please. And as mentioned also that 40% of the human rabies cases are actually children. And here we see that often the close link of children and dogs, that put them at risk, because often as they are small, they are also bitten either in the hands or in the face. And clearly, as we know, if rabies, the virus travels through the nerves, and when it reaches the brain, arise and people die of the disease. So clearly children are very vulnerable when they are bitten, especially in the areas around the face. So control of dog populations need to be also accompanied with change in human behavior. So people taking responsibility. Often what we see that owned dogs that the community know, but that are not vaccinated, these might be the most dangerous one, because these are the dogs that people are familiar with, and they might, approach, have a closer contact with the people, and might bite them, and then people might get the disease. Dogs that are not known by the community, people will not get near to them in many of the cases. But here again, responsible dog ownership is key, that people take responsibility of the dogs they own, but also of the dogs that roam in their community. Next slide, please. So just to mention a bit more on the importance of the various stakeholders. And here I have listed many of them. So it's the government, the private sector, the private vets also play an important role, and certainly universities. I personally have organized large vaccination campaigns in Lusaka, Zambia, with veterinary students. And we have managed to vaccinate dogs, over 9,000 dogs, for example, over a weekend, just by having teams of students working with government and with, for example, the Rotary Club. We managed in just 2 days to almost reach 10,000 dogs. So these are, it's all possible, but it's important to all kind of have a joint commitment and work together. Next slide, please. So if we see also just to finalize my presentation, and I know I'm going over my time, the control measures, I've listed here many of the control measures, and I will not go into detail of each of them, but there are many interventions that can be done. But again and again, I want to stress that reaching high levels of dog vaccination, this is absolutely key and the best way of controlling the disease. Next slide. So we have now, there will possibly be some discussion on euthanasia of dogs, and clearly this is one possible measure to euthanize dogs that are not owned. But clearly this should be done in coordination and also with the communities, as this can be controversial in some cases, and working also with animal welfare organizations who can be very voiceful about this. So despite all, importance of dog responsible ownership, I see there is a message, but I'm sorry, I cannot see. I suppose this is for the discussion afterwards. So next slide, and I will jump a little bit faster over it. So some activities, these are, for example, the 8 teams in Bali that were developed. These are specially trained dog catchers, and they're part of the vaccination campaign. Next slide. We also have been engaged in increasing government engagement and developing the collaboration between animal and human health by this integrated bite case management. Maybe in the discussion I can elaborate more on that if there's interest. Next slide. And then, how to engage communities, because they need to be the one who collaborate with the government and collaborate by bringing the dogs for vaccination. So how to access communities and increase their awareness. Next slide. And here, just to mention again, World Rabies Day as a very important moment to increase this awareness. Next slide. Next slide. Okay. So just to mention the advocacy, and there are many, many tools that have been developed. So in conclusion, rabies is still a neglected disease in the region. We still have many human cases. There's always too many human cases because even one case is one too many. And we have this continued endemicity of the control. It is re-emerging or emerging in previously free areas. As well as we need this intersectoral coordination also between the different countries. So this is still an area that is very important. And having today veterinary and medical students together is essential. You are the future professionals and you are key in also controlling rabies. So we need to understand also the social cultural factors that are often different in different countries or in different parts of the countries. And then again here to stress the regional collaboration and cooperation. And then 0 by 30, I know it is challenging, but we are able to do it. I think we all need to unite. Next slide. And with this, I really would like to thank you very much for your attention. And, it's difficult not seeing you and not having a direct discussion face to face or being able to present. But thank you very much for the organizers for organizing this important event and for inviting me to speak. Thank you. Over and out. Thank you.
Thank you, Dr. Katinka, for such an informative and a holistic presentation. You've highlighted all of the current scenarios involved and also the major stakeholders. Okay, so I do see some questions in the chat box. Some are thought-provoking and we can address them later during the Q&A session. All right, so now let's proceed to our next presentation. Our second speaker is Professor Dr. Razitasham, who specializes in public health medicine pertaining to family health and is a member of the Epidemic Intelligence of Malaysia. She is a member of various professional bodies and actively contributes as a consultant to MYOHUN, several NGOs in Kuching and the Sarawak Health Department. So without further ado, let's all give a warm welcome to Prof. Razita.
Thank you, Sajida. I will share my slide now. Can you all see my slide?
Yes, doctor, we can.
Okay, thank you. Assalamualaikum and good morning. Thank you very much for Committee of Student One Health Club from University Putra Malaysia. And a special good morning to all the speakers, Prof. Latifah, Dr. Stephen, Dr. Katinka. Actually, it's my great pleasure today to share with you some of the stories, our experience in managing rabies in Sarawak. So what I will do today is I will describe a bit of natural history of rabies infection, because to control the disease, you must know the disease. And history of rabies in Sarawak, I will highlight what Dr. Katinka has mentioned, and epidemiology of rabies in Sarawak based on our preliminary data that we have, and discuss on the One Health approach in rabies management, what have been practiced, and maybe what else we can do with regards to rabies management. And lastly, I will conclude my presentation. So for natural history of rabies, I think Dr. Katinka did mention in her slide about the interaction between the agent, the host, and the environment that you need to create a disease. For example, rabies is a very good example of the One Health concept, whereby you can see the interaction between animals and humans very close to get to create the disease in human. So in rabies, the agent is we know is Lassa virus. You can get it from animals, for example, in cats and dogs, and especially in Sarawak, we have more cats positive for rabies virus. And how do transmission to human occur? So definitely there must be an interaction. And we know that even though we have positive cats, but the one that cause human rabies are mainly from the dog bite. So we know the contact between the dogs and the human must be there to get the possibility of infection. So all those interaction, or we call it interface between human and animal, are made doable because of the environment that we stay in. The environment in such make the animals conducive for them to be close to human. For example, like in dog, definitely when you have availability of food, or if you have a porous border between endemic area to non-endemic area, then there is a chance for us to get the interaction between human and animal. And definitely what we see as a human case is just a tip of the iceberg. So we know when we have a human case, definitely you have more, when we have one human case, definitely we have more animal case surrounding us. So that is the impact of the enzootic and epizootic rabies in the animals. So the human case is just the tip of the iceberg of the disease in our area. Okay, this has been mentioned by Dr. Katinka, but I like to highlight one more that in our region, Southeast Asia region, our main host for rabies are still the dog. And what worries us is that it's supposed to be, the rabies is supposed to be in the wildlife animals, but we have more in our domestic animals now. So there is the effect of spillover effect from the wildlife to the domestic animal. So the reason why evolution of this virus from the wildlife to the domestic is still not much clear, and still a lot of study conducted, especially in the wildlife areas for this evolution. Okay, I like to highlight again the facts about rabies. We know that public awareness is very, very important to control our disease. But how to create the awareness? How do we use to create the awareness among population is very, very important. It's not just giving health education. What we observe, especially in this rabies or in any disease, you must create the fear factor for the public, for them to aware of the disease surrounding them, to create fear. That means to create that they know that they are at risk to get the disease. Only then your health promotion will be more effective. Yeah, and definitely no dog bite, no rabies. So the main thing to control human rabies is still to control rabies among the animal population. And I also like to highlight vaccination among the animals. We know the facts that vaccination among animals, in this case dogs, are one of the effective strategies. But bear in mind the effectiveness, or to reach the herd immunity of this vaccination strategy, you need to control the population. In this case is the dog population. So together vaccination and control of the dog population. So in area like Sarawak, we can still see a free roaming dogs or stray dogs in our what we call the red zone area. So I think this is the thing that as a community or any officers dealing with this activity must pay more attention to the presence of stray animals in the area of rabies. So as from 2017, when we were diagnosed our first outbreak of rabies, we have now 31 confirmed case of rabies, human rabies in Sarawak. And a bit on how rabies enter the brain, Dr. Katinka did mention in her slide, but I like to highlight again, when the virus entered the human through the infected saliva, it will replicate in the muscle. And bear in mind, even when they are in our human bodies, the human will not get the symptoms until at the end of the presentation or at the end of the phase of rabies presence in human, which is the features of encephalitis. And when human presented with the clinical symptoms, fatality almost more than 99%, which I will discuss some in our next presentation. Okay, so this is the clinical cause of rabies in human. So basically, the incubation period roughly about for human rabies is about 2 to 3 months. But you can see the variation in the incubation period, which we can see in our human cases in Sarawak. So a bit of some history of rabies in Sarawak. Based on this WHO world map, the presence of dog-transmitted human rabies in 2010 to 2014, we can see that the one that I circle, the red circle, is where the presence of human rabies in Indonesia, in Southeast Asia region. And you can see in 2014, Malaysia are still absence of dog-transmitted human rabies. And for Sarawak, we know Sarawak is located in the Borneo Island, and we share border with Kalimantan. And some of our border are very, very borderless. It's a very porous that not only the dogs, but also the human can go without using our passport. So it's a very, very porous border. And the one that bordering Sarawak is the West Kalimantan and also part of the East Kalimantan. So if you look at 2013 level of risk of human contracting rabies, we know that our neighbor Kalimantan are high risk and Malaysia at that time was low risk. So based on this map, we further go and analyze more data of what happened in the Borneo Island. So what we have, what we get from the Eco World Alliance is, if you notice the map on the right side, the Kalimantan area, they are already red. The East Kalimantan was infected, was a rabies area in 1974. And it's only recently Kalimantan Barat, the West Kalimantan, was the last province affected by rabies in Kalimantan. So, further analyze on what happened to West Kalimantan using the local newspaper of Kalimantan, the local news. So, what we know is from September 2014 and August to 2015, the West Kalimantan has an outbreak of rabies. So that is the period of where they have about 730 dog bite cases and 19 died because of rabies. So looking at the whole scenario, so can we predict the outbreak? Will the rabies come to Sarawak? The answer is yes. If we put all this data together, analyze the data, actually we know that Sarawak is at high risk of getting rabies. And because of this, in 2016, under Malaysia One Health University Network, what we did was we conducted a rabies One Health field simulation exercise where we call all the staff or all the multiple agencies, which include the human health, the animal health, and also those who are responsible for environmental health. So actually, in this is actually a very good exercise which create the awareness among the possibility of rabies in Sarawak, especially to the stakeholder, to the respective agencies. So this is the exercise that we did in 2016. And in 2017, Sarawak first declared our rabies outbreak on the 29th June, where 3 cases were admitted with unusual encephalitis presentation and was noted to have positive rabies. So the first district involved was the district which is very close to the border. And these are the 2 out of 3 victims. These are the 2 siblings who died on the same day in July 2017. Okay, and not only that, in the news, because of rabies, for the past 20 years, we don't have rabies, and suddenly we have rabies. So we have a lot of coverage in which include the news. And in one of the news was reported that in the affected kampung, which is Kampung Paum Rimu, the community, the villagers observed that their dogs has been behave abnormally since April, and actually some of them kill the dogs because of the abnormal behavior. So next one, what I will share with you is the epidemiology of human rabies in Sarawak based on our preliminary findings. Why I call it preliminary findings? Because all the data that we have is based on the official online press statement made by the DG of Health in Malaysia. So based on this preliminary finding, we plan to do more extensive finding, more extensive research on more of the epidemiology of human rabies in Sarawak. So what do we have based on this time? Based on this finding, since 2017 until the end of 2020, we have 31 human rabies cases. And out of these 31, we have 2 survivors, both are children, and these 2 children has history of immediate treatment. So in our case, the case fatality rate is 93.5%. So this photo show one of the survivor, the 10-year-old boy who survived rabies infection. Okay, and we look at the trend of human rabies. Since 2017, we have 6 cases. In 2018, we have 10 cases. And 2019, we have 6 cases. And 2020, we have 9 cases. So the most reported cases was in 2018. And definitely, we can see that every year we have more than 5 cases. And the mean number of human cases for the past 4 years was 7.75. And definitely the highest cases recorded was in 2018. So a bit about special distribution of human rabies. As you can see in my slide, most of the cases are located at the southern region. If you notice, all those southern regions are very close to our West Kalimantan. But currently, the human cases now move to more central region. And for the district, for the human rabies, all of our division now are infected with rabies, rabies infected area in Sarawak, all the division for animal rabies. Okay, in terms of age distribution, we have more adult compared to children. So in this case, below 15, we only have about 10 cases out of 31 total cases. So this is a big difference from the global distribution based on the age. And in terms of male and female ratio, we have more male than female. And definitely, we have more rural residents compared to urban residents. In the occupation, most of the data are not available in the press, but you can see that those affected are actually from the majority are from the low income family. So next we analyze the exposure history. So out of 31 cases, 6 has no exposure history, but from those who had history of exposure, primary are actually from dog, and 60% of those dog are actually 60% of the bitten by dog are actually from stray dog. And out of bitten by own dog, the habit of this own dog are still free roaming, and there is no history of rabies vaccination. And we also take note that 5 out of 31 victims, which is 60% of the victim, adopted stray dog with unknown rabies vaccine history. However, for the exposure site, even though most of the exposure site was not mentioned in the news, but mainly what we can get is upper limb and lower limb, and also face and neck region. And we know that the higher is the exposure site, is faster you will get the clinical presentation. So the incubation period, based on 25 cases, the minimum days is 16 days, and the maximum days is 715 days. So our mean days is 131, with median day is 77 days. And 2 cases had a very long incubation period, which is more than 1 year. And almost half, 48% of the cases, incubation period is actually less than 60 days. And 24% of the cases has incubation period more than 100 days. So on the right side, example of the history of 2 years history of dog bite, only then the victim developed the clinical features. So in terms of PEP, post-exposure prophylaxis, out of 31 cases, 80.6% has no PEP, and 3 cases has incomplete PEP, which include the 2 survivors. And all our patients were hospitalized. The median duration of disease is between 12 days, which minimum day is 2 days and maximum days is 33 days. And definitely most common clinical symptoms is typical rabies symptom, which hydrophobic and weakness in the limb and aerophobia, seizures, fever, and sore throat. So in summary, in the epidemiology, out of 31 cases, we have our case fatality rate of 93.5%. We have 2 survivors and both children with history of immediate treatment. And out of 31 human cases, mostly they have no PEP, male adult from the rural and from low income group. And exposure are all dogs and mostly stray, and the own dog are actually free roaming with no rabies vaccination period, with no history of rabies vaccination. And in terms of incubation period, is about 2 weeks to 2 years, and all cases were hospitalized, and predominant clinical features is hydrophobic. And the risk factor that we identify in our preliminary study is the culture of stray dog adoption. Okay, so next I'd like to move to the One Health approach in rabies management, what we are doing, and maybe what we can strengthen in our case management. So a bit about One Health paradigm. One Health paradigm is a concept that we change the work approach from our vertical or segmental approach to a more horizontal across discipline approach. So in the classical approach, we always ask who do what? What do I have to do? What am I responsible for? Is this my job? But in One Health approach, what we ask is what needs to be done. So, and all this practice need to be, all this One Health approach concept need to be practiced at any level, not only at state level, it is also very important at district level and also community level. And of all the things that we need to break down our professional barrier through improve our communication. So I will skip this slide because I don't have much time left. Okay, so very important message, especially to all the students, since you are our future One Health workforce, is the importance of surveillance. All of us are doing surveillance, but we must know what is the objective of your surveillance. For example, in rabies, in public health, human public health, we are doing animal bite surveillance. So we must know what is the objective of this animal bite surveillance. So animal bite surveillance is a proxy to abnormal behavior in animal, in a way that in a rabbit area is a proxy of rabbit animal. So when we analyze data, we should ask, why is this happen? Who are the person affected? Where are the area? And all this surveillance data should be shared with other agencies for them to do more of control and preventive measures. For example, like if you can see in this slide, with the free roaming dogs, this is still a common scene that you can see in area, even a positive rabies area in Sarawak. Okay, and this is some of the activity. Maybe most probably Dr. Stephen will highlight on this. Yeah, the role of animal health, the role of environmental health, our concern, and definitely human health. And on top of that, leadership and management is very, very important to support all this activity. Okay, I like to share what we did in Kota Semarahan under the leadership of the City Council on the the healthy city concept, the healthy city approach on safe city concept at Taman Samarinda. So we have put control of rabies as one of our agenda, and we ask the community to think on how they can control the dog population at their level. So this is the photos of the workshop that we had in December last year. And definitely our ministry wants zero stray dog policy at rabies infected area. So I like to share a good example done by Kuala Lumpur City Council, whereby they get the volunteers or the community to help to catch the dog. So this is also a good practice that we can bring to our local leaders in Sarawak. Okay, part of ACD by the health team. So actually ACD or active case detection after the notification of human rabies is also a good practice where we can incorporate the One Health concept. That means join ACD activity together. Join activity together between the human health and also the animal health. Okay? So example of the mapping before the ACD conducted, and the sample of the form that they use during the ACD. And definitely we have issues and challenges. And one of the issues is ineffective delivery of important message. As I mentioned earlier, we must know why is our message is not effective, because villagers still live. What we have observed is villagers still leave their dog roaming freely. So our message in the health education did not instill the fear factor. So this is something that we need to work out on how to create fear factor in our community. And we have a good cooperation between all the agencies, but still there are still rooms for strengthen the collaboration. There must be a regular exchange of information at all the level. And definitely we need a cooperation with the local villages. And as a conclusion, an event in infectious country, for example, infectious disease in one country is a transnational threat to neighboring country. For example, as what happened in Sarawak is a good example of this statement. And the more important is the data that are available need to be analyzed. If you have data but not analyzed, so there is no, that you will not achieve your objective. So important data to analyze and to share the data to all the responsible officers or all the responsible stakeholders for the aim of control and prevention. And rabies, we know that still rabies in Sarawak still pose a public health threat. And since Sarawak is a very big state and the border are very, very porous, so we need more of targeted approach. And the means of targeted approach is use the current data, analyze the data, evaluate whether the current practice is effective or not. So those are the evidence-based practice. And definitely even though we have a good collaboration, but we still need to strengthen by the coordination of action and information need to be on regular basis, not the ad hoc basis. And definitely, effectiveness of public education should be the main agenda, because we know to clear the free roaming or to control the dog population, we need a lot of help from the community. And my message, even though we always blame on the community, which is not helpful, but never give up on the community. Because if you can tackle them, if you are able to tackle them, you can have the most effective ways of prevent disease to animal and also to human. And definitely community engagement need to be strengthened in our control and prevention. So with that, I like to acknowledge all these names here, and please feel free to email me for email me using my email address stated in this slide. So thank you very much. So I'd like to hand over to Sajida. Thank you.
Thank you, Prof. Razita, for the very clear presentation of epidemiology. Thank you for addressing to everyone on how the importance and also the repercussions of zoonotic spillover, especially one involving a very fatal yet avoidable zoonosis such as rabies. So although the question streamline has slowed down as we progress, yeah, I do hope the audience still have more questions reserved as we continue with our next speaker. So his name is Dr. Stephen Gabriel from the Department of Veterinary Services, Sarawak. He is currently the Deputy Director in Veterinary Health and Compliance. With ample experiences under his belt, he is the go-to person for rabies control and elimination program under the department. So without further ado, I'm going to pass this over to Dr. Stephen for his presentation. Thank you.
Thank you, Sajida. Good morning. I'm sharing my slide now. Can everybody see it?
Yes, Doctor.
Can they all see my slides?
Yes.
All right. Okay. I'll being the third speaker for this morning. I think quite a number of my slides actually have been seen by some of you in other forms. Nevertheless, those that have been explained by the previous two speakers, I probably skip, and those that I think I need to elaborate, I'll go in detail, okay? Okay, next. My topic actually is current prevention that we undertake by the Department of Veterinary Service in collaboration also with other agencies. So this is the outline of my topic. I'll talk about what is rabies, the current situation, the control measures adopted, main challenges, way forward, and finally, the conclusion. Next, please. Rabies, if you see that slide actually was last year's World Rabies Day theme. Normally it's celebrated in September 28th, but in Sarawak was celebrated a bit later than that day, since sometime in October. So the theme for last year's World Rabies Day was End Rabies, Collaborate, and Vaccinate. So you see the word there, collaborate. That's where One Health approach is quite pertinent. Okay, this has been explained by the previous speakers. Can I go to the next slide? Okay, the sign of rabies in dogs are quite similar to human. There is fever, there is hydrophobia, paralysis. Now, what the next part of the slide actually was also presented by Prof just now. But what I like to emphasize in dog is that as the disease progresses towards the brain, after it reaches the brain, it goes down next to the salivary gland. The salivary gland, within a period of 2-3 days, the dog would not have shown much aggressive behavior, but the virus load in the saliva would have been the highest. So We have to be careful, although the dog is not aggressive that time, but if the virus load in the saliva is very high, and if it beats a human and the wounds are not washed properly, or no PEP given, or no RIG given, rabies immunoglobulin, the disease could still progress through the peripheral nerve, through the central nervous system, up to the spinal cord, to the brain, and that's how in human the disease show itself. So we have to be careful that those, even though they don't seem to be aggressive, but if they're harboring the virus disease, the virus rabies could be quite high in the saliva. Okay, next. Now I go to current situation. This has been explained by Prof now. If you mentioned that 1974, that's when the transmigration of people from Java into the Borneo Highland. So there's a lull in 2014 where there was no report of rabies in Kalimantan. Maybe they didn't report it, but by the year 2016, it's already near our border with the Syrian district. So the first human case that was confirmed by the Ministry of Health, I think there was an article, was on the 30th of June, and on the 4th of July, the Minister for Agriculture declared that area, Syrian, as a rabies infected area. Now, if you can see that all this declaration made using our Veterinary Public Health Ordinance 1999. Now, it's good that we already had the ordinance in place. It would be easy to gazette an area, declare an area infected, and as well as areas that we need to do mass vaccination, or we institute anti-rabies vaccination order. So, in fact, in our ordinance, there's a special chapter, special provision relating to dogs in connection with rabies. So, there are four sections in that part where we can use it immediately to control and to enact and to gazette area that are infected with rabies, so that we can do all the necessary vaccination, culling and whatnot. Okay, next. If you notice, rabies is one of our DVS program under Animal Disease Control and Eradication Program, apart from very important for the mouth disease, avian influenza, bird flu. Rabies in red there is one of the disease that we, together with medical department, have interagency or interministerial meeting over the years on zoonotic diseases. Okay, next. Okay, up until late last year, Limbang was still free from rabies, but somehow in December, we have one case near bordering Brunei, actually, in Limpaki, an area called Limpaki, where we detected presence of a rabid dog. And we have 2 positive cases in that area lately. Thank you. Next. And now this is just a brief recap on what we current situation of rabies in Sarawak. 66 areas affecting all the 12 divisions. We have 29 rabies, 29 deaths out of 31 cases. And we have targeted removed something like more than 30,000 stray dogs. And there are about 23 cases of dog bites, which our department is working closely with the medical under the integrated bite case management. And we have vaccinated, in total, we have given about close to 200,000 doses. Some are booster doses and some are first shot. And we have this estimate of like 205,000 dogs own dogs in the whole state of Sarawak. This is excluding the strays. So there are still plenty of dogs in the street. That's why, despite so many attempts by council, municipal council, and local council to remove the dogs are still found in the streets, eating places, garbage dump site, on the road. Okay, next. I mentioned just now the ordinance that we use, the public health ordinance. We have this, so it makes legislation quite fast, quite effective. And we can compound people who, let their dog loose, refuse to have their dog to be vaccinated and all this. Okay, next. Now, just to recap, there's a special provision to dogs in connection with rabies. Declaration of rabies infected area by the minister. Movement of dogs require movement permits, and dog must be kept under effective control. Effective control here means they should not be out of your compound. So a lot of dogs actually, they call it free roamers. At the moment the master leave the house, the dog also follows suit, and then wait for the master to come home. Wait for the master to come home, then the dog come in. So these are free roamers, we call it, and these are dogs which are actually that can harbor rabies disease. We have instances recently came to mind where meter readers are being bitten by dogs. They have a long leash. The dog can come out of their fence and bite this meter reader. So that's not effective control. That's it's convenient for the dog to go move in and out of the house, but then it's still they could still between the fence they can still quarrel and they can still bite each other. Now we have destruction detention of animals under Section 38, quarantine of dogs that has bitten people, and anti-rabies vaccination of dogs under Section 40. So all these are legislation that we have to combat rabies. At the same time, the local council also have made their own local in relation to licensing, in relation to microchipping, and vaccination for their dogs. All is applicable to all the local council in the state. So these are the legislation that we are using, the veterinary department and also the local council, the control of rabies in the state. Next. Okay. Because rabies has spread from one district, from Syrian, and to other district in the southern region that time. So in the year 2019, rabies was put under Majlis Keselamatan Negara, or NATMA, which NATMA means National Agency, National Disaster Agency. So under disaster level 3. So in this, under NATMA, Parahan number 20, all relevant government agencies will have to assist in the control of rabies in the state. So we have the police coming in to assist, the RELA, the BOMBA, all other, the RTM, UCAS, many other agencies, all helping our department. Also, of course, we have also our big brother from DVS Kuala Lumpur assisting us in the combat of this disease. Okay, it started in March 2019, ending in December, where we actually emphasize on eliminating rabies, especially in the rural areas. Next. Okay, the control measures adopted from the very beginning when we had our first workshop plan of action in September 2017. We are already employing this One Health concept, sharing responsibility and coordinating. These are basically One Health concept, a tripartite concept that was mooted in 2010, but for 2015, that's where it comes for the the global framework for the elimination of dog-mediated rabies. Next. So basically, this was mentioned by the first speaker just now, one of health approach. The OIE, which actually is World Organization for Animal Health. OIE is a French term for Office of International Epizooties. These are the one that is handling the veterinary part of it. The World Health Organization handling the human part of rabies control. So the One Health approach, if we can eliminate rabies in dogs, there'll be 0 human deaths, and we can get rid of rabies. So it's targeted by 2030. A whole world effort, a tripartite effort, together with Global Alliance for Rabies Control. These are the 4 agencies that are very much involved in for the 0 rabies by 2030. Okay, next one. Okay, basically, this is in detail the global framework for the elimination of dog-mediated rabies. Is quite small there, but you can download it actually, and the vision is 0 human death from dog-mediated rabies by 2030 in participating countries. I think under OIE there are about 176, I think, last count OIE members. So if you are adopting this method of rabies control with help from donor countries, help from all the expertise, we can actually eliminate rabies by 2030, as mentioned by Dr. Katinka just now. If you look at the success in South America, is where they employ One Health concept, rabies can be eliminated provided everybody play their part. So there are 5 pillars there. Stop R, I used to remember it in short. Social, economic, number 1. Number 2 is technical. Number 3 is organization. And then number 4 is political will. Number 5 is resources. Stop R, stop rabies. That's how I remember it. So under social economical, there should be awareness program, responsible pet ownership, bite prevention, how to avoid being bitten, and post-exposure prophylaxis. When you are bitten, you need to have yourself have to do first aid, wound cleaning. We recommend that you wash the wound running water with soap for 15 minutes and then rush yourself to the nearest bite clinic or hospital for further management by the medical personnel. Under the technical, we are talking about vaccination, the logistic, and the diagnostic. Now, here in Sarawak, I think our veterinary diagnostic lab, we've been able to, in fact, test for a rabbit dog in a very short time. We can even do it within half a day. And we also have test for rabies, which is quite accurate, the bionote test, and I can also determine whether the dog is rabid. But of course, all these animals have to be put to sleep or euthanized before we can take sample of the brain for testing. Under One Health concept I mentioned just now, there will be collaboration between all relevant agencies, the medical, the local council, the veterinary, to determine whether there's indication for PEP or not, post-exposure prophylaxis. Of course, more importantly, there's a good governance have to be in place, right? Now, the 4th pillar is political will. Together with political will, there must be money provided. Despite COVID last year and this year, we are still going all the way out to vaccinate. If we can move, we do vaccination. So we're trying to cover as much area and vaccinating dogs. We even go house to house for our vaccination program, or where possible, when there's no MCO, then we can do a mass vaccination in some of the venues that we can have where SOP for COVID can be undertaken. So we need to do social distancing when you bring in your dog for vaccination and all that. Of course, the last pillar is resources. Now, as mentioned many, many times, once the disease is endemic in the state or in the country, it will take quite a long time to eliminate the dog population, because there are so many of them harboring the virus, incubating the virus, and have not yet shown a rabies sign. So we still have to be, even though we do monitoring, surveillance, we are not still able to actually have a good picture of the extent of rabies in our dog population. Also, bearing in mind that veterinary department in Sarawak is a new department, only started in January 2017, and already by July we are deluded with this rabies. So we are very much stretched, and we are getting help from our counterparts in Semenanjung and also our counterpart in Sabah to help us with the vaccination program at least. Right, next slide. Now, as mentioned many, many times, the primary rabies control is vaccination. It's the most cost-effective, sustainable. Was mentioned like $1. I think we have calculated in Sarawak it costs about $20 per dog. Even if you that's the government rate, but if you do it at the private sector, may cost you about $50, but still cheaper compared to getting rabies immunization in human, which can run into the thousands when you have 4 doses to be instituted for protection. Okay, next one. Was mentioned just now, herd immunity. You have to vaccinate enough dogs to block enzootic transmission among dogs. The model that shows that if you can vaccinate more than 70% of the dog population, you'll be able to stop the transmission. You need to sustain this vaccination coverage for at least 3 to 5 years before freedom status from OIE. Okay? So, and it's also mentioned there that one dog can potentially spread rabies to 1 or 2 other dogs, because if they get rabies, they also, some of them will just disappear to the jungle and die. Right, next. Okay, this is another picture to show reservoir in the canine and the wildlife, especially the bat species, and the human, the animals and the cats there, they are hen-hosts. We don't actually spread rabies among humans. Okay, next. Now, this is just a slide I want to share, which I got during my when I was when we went to Bangkok that day for a workshop on rabies. It says here that a lot depends on when you can reach that 70% coverage and you maintain it for 3 to 5 years. That's where you can stop rabies. So to me, in Sarawak, we're still at that scaling up phase. We have actually not maintained, reached that 70% overall, including new dogs, vaccinated dogs, those that are getting boosters. Because the rabies vaccine that we have now is we need to vaccinate every year. So unless we have some vaccine that we can that can be good for 3 years, we would still be struggling, scaling up. And we're still now with COVID, our movement actually is restricted, and we are not able to organize many mass vaccination exercise to reach that so-called 70% vaccination coverage. Okay, so this by Ryan Wallace said that every country can eliminate canine rabies through vaccination within 13 years. So we did, during that exercise in Bangkok, we put our inputs into SARE, just now mentioned, stepwise elimination of rabies control. For Sarawak, it's still like 7.5 years. So we're still halfway through. And hopefully by 2025, we should be able to eliminate dogs, rabies in dogs. That's our target, actually. Next slide. Now, rabies control, as sum up in this slide, we have a public awareness program, stray population control, of course, mass vaccination, house-to-house vaccination, integrated bite case management, together with medical and council, and we have our legislation in place. Okay. So, next slide. Now, if you see that this slide, when we first started our plan of action in 2007, the version 1, we were thinking that rabies was just in the southern part of Sarawak. We tried to have a buffer zone or even belt along the Batang Lupa River. That's the one before Cebu town. But then, because it's already endemic, this actually, the immune belt or buffer zone between the southern and central region was very fast. It was breached in no time. To our surprise also, we have positive dog in Kapit in 2018, early part of 2018, even before we detect rabid dogs in Cebu division. So we sample 5 dogs just have in Kapit town showing no signs of rabies disease. But then when we test them, all 5 dogs were positive for rabies. So that's very alarming. Kapit is, you need about 3 or 4 hours by motor launch to reach Kapit, but still dogs were already moving from Cebu probably to Kapit. And if you see the 2 lines down, that's our border with Indonesia. The first line about 10-kilometer zone. If you want to have a 10-kilometer immune belt, or the upper one which is a 20-kilometer immune belt. Next. Okay, under this plan of control, version 1, we have actually 10 activities that we want to do. Want to contain rabies outbreak in an infected area. Once an area is declared rabies infected, we would have a 10-kilometer surveillance zone where we do all the vaccination within the infected area, as well as those within the 10-kilometer radius. And we do a lot of sampling. We do surveillance and monitoring. But we have to bear in mind also, dogs move fast. They jump on transport. People move their dogs here and there. And from the first outbreak area in Syrian district, and within 1 or 2 months, they spread to Kuching. They spread towards Suriaman in Lachau, that area. Okay. One of the 4th strategy is to prevent spread to new areas, but because, like was mentioned in one of the Prof's slide just now, even in April 2017, Prof was mentioning that the dogs were behaving funny, abnormal behavior. Some reported that these are like zombies. They come in the middle of the night, bite people, and disappear. Of course, in Syrian, there are a lot of plantation areas. If you see in green there, those are plantation estates. And they're also the same color on the other side of the border, because some of the plantation are owned by Malaysia. So they have more or less like a free area for the dog to roam. So you can, the instances in those few kampongs that were first, when first rabies first occurred, the people from the other side, they are going to our our villages in Sarawak, in Syria, to buy the provision, the daily provision. And along with them, the dogs came along with them. And if it is a mating season, because even though the owner want the dog to come back, the dog would rather stay back and mate with our dogs here. So during mating season, there'll be a lot of fights among dogs. That's how rabies actually spread very fast among the dog population. Okay, next. Okay, the fifth control activity, we need to improve our detection of diagnosis of the rabies virus in our dog population. Prior to this, we had to send our sample to VRI. We have to carry the head in a plane, in a cool box to VRI. The result may take about a week. I mentioned earlier, with the test that we had, now we have our own tests. We can do this DFAT test in our own lab, and it'll take within a day or two, less than a day, we can have confirmed or otherwise. Next, please. So the of course, number 6 is managed dog population. It's always been mentioned. We need people to, have their dogs sterilized so that they don't multiply. There are a lot of dogs that we need to catch if there are no owners. If there are owners, even then we don't allow them to claim if it's in a rabies infected area. Okay. Of course, we encourage people to have their dog neutered, castrated, and spayed. But then it's a lot of attitude of dog owners. One, they couldn't be bothered. That's why, number 2, if they have too many dogs with them, most of them, they would just abandon the dogs. And we have a lot of areas where dog can, find food. Some in restaurants, in dumping site, in dustbins, they can find food. You can see even stray dogs, they are quite rounded, they're quite healthy. Yeah? Okay, next. Number 7, one of control measure is strengthen our animal bite surveillance and management of bite cases. We have dog bite clinics. I think there are most of the main division now have dog bite clinics, and the one in Kuching and Syria is always very full and very crowded. A lot of bite cases every day. At one time, there were about 300 bite cases a day. It's been a bit reduced now, but they're still quite busy until even to the present time. Okay, number 8 is establish stockpile of anti-rabies vaccine for human as well for animals. At one time, most of the human rabies vaccine were in Sarawak. Even the stockpile in West Malaysia were all gathered here in Sarawak because of the number of human cases, number of humans that require rabies vaccination for human. Of course, our RIG stockpiles also we need to keep here. Next, number 9. Some pictures. These are credit from the dog bite clinic. Children normally they are bitten in the face, the eyes, and the hand because of their height. These are, of course, just now we mentioned a lot of adults are bitten. They are in upper extremity and arms. Next slide. Okay, these are the forms that we use together with medical. Once they have cases, they will fax this to us, and then we have to look for that particular dog that bite this particular patient, and to determine whether the dog actually is rabid or not. And if they can do it fast, it will save on the PEP. But if the bite is severe, category 3, the patient will definitely receive all the necessary PEP or even the RIG during the wound treatment. Next. Okay, good governance. We have to do audit on what we have been doing even before, even like 2 or 3 years after our rabies operation, we are being audited to make sure that whatever is planned is being implemented. And of course, more importantly, that the resources are used properly. Next, number 10 is enhanced capability of diagnosing human rabies in Sarawak. We have a grant given by the state government to UNIMAS to develop for maybe on-site testing in hospital rather than send them to IMR. And of course, UNIMAS have confirmed that the rabies variant that we have in Sarawak are the same phylogenetic strain from the Kalimantan rabies cases. Okay, next. Okay, now that was previously the 10 activities under Plan of Action 1, but despite that Plan of Action, rabies is still spreading throughout the state. So we had another workshop sometime in 2019 January, where we look at why rabies is still spreading despite all our efforts at controlling by vaccination to other parts of the state. Now, this is the model. You can have a look at it, all the activities that we need to do. But in the final analysis, this is what we have in our Plan of Action version 2. We plan to eliminate human rabies in Sarawak by 2022 and eliminate canine rabies in Sarawak by 2025. That's our target for rabies control. Now, the first one, eliminate human rabies in Sarawak by 2022. To do that, we have to aggressively promote our vaccination, try to reach that 70% vaccination coverage. With now movement control in 2021 still on, I think hopefully human death could be prevented if most of the bite cases, human bite cases, are being taken care of properly, getting the necessary PEP when they are bitten. Of course, our education awareness program, we still have to step that up. Right? Otherwise, like mentioned earlier, so many cases, I think 5 cases this year, they were not getting the necessary PEP. They didn't know when they were bitten even. They can't recall. Of course, when they already have sign of rabies, you can't recall when they are bitten. Sometimes small bite, small scratch, and they don't bother about getting wash the wound, and they don't bother about getting medical attention. That's why rabies develop. We can see the incubation period can be as long as a year plus. Okay, so under the Plan of Action version 2, the mission is actually to have a sustained vaccination coverage of 70% of dog population, reduction of strays and free roaming dogs, and optimizing our resources. So the objective there are 7 or 8 there. Coverage from 60 to 70% within 1 year. We were hoping to do that last year, but because of COVID and our resources, we were not able to achieve that 70% and maintain this coverage for at least 3 years so that we don't have human cases, and optimize and prioritize our resources, good governance, collect data for decision making, and if possible to have 0 strays in the stream, which is a very tall order, but then we try to, if we can we can't have 0, at least we minimize our stray in the street, and to enhance our surveillance in order to establish rabies-free Sarawak. These are objectives under Plan of Action 2. Of course, Plan of Action 1, version 1 and version 2, we are doing it in together. And now under NATMA, I mentioned earlier, because rabies is under disaster level 2, last year, 2019, actually, we're going all out to cover the length and breadth of Sarawak, vaccinate as many dogs as possible, and to remove as many dogs, as many free roaming dogs and strays. Okay, there were 8 phases conducted from Lundu all the way to Limbang. We managed to remove quite a number of stray dogs in these areas. We have also app that we are currently developing to track rabid dogs. Next. Next. Now we also have this disaster information. I think now with COVID coming in, like I mentioned earlier, I think COVID also play a bigger role in this disaster. COVID is considered disaster, so it comes under the ambit of the State Disaster Management Committee. But even though COVID is very much in the news now, rabies is still also being, rabies control is still being promoted. If you see a lot of banners or billboard in the state of Kuching or in most of the town in Sarawak, rabies control also occupy half of the billboard space. So we have half of the board on COVID, half of the board on rabies. So it's still important under the state disaster that we have to control rabies. Next thing. Of course, we also have collaboration with Sarawak, Kalimantan Barat. We have also initiative under One Borneo Quarantine. We're meeting with Indonesia, Brunei, Sabah to initiate. One of the topic is, of course, rabies control. Also mentioned just now by the speaker. Indonesia is also taking an active role in control of rabies, but Indonesia have problem with logistics, have problem with vaccine, and their vaccination coverage, I was told during one of my meetings, is less than 30%. So rabies will still be a problem unless they step up their vaccination coverage in Kalimantan, Borneo. Okay, next please. Okay, the main challenges next. So geographical and social. I mentioned just now logistic resources. The risk of wildlife spillover. So far, we have not detected rabies in our wildlife. That we have conducted some tests. Okay, of course, there's travel advisory being. Some countries, they have mentioned some travel advisory when you go to Sarawak. You need to have yourself vaccinated against rabies before you can get insurance for your travel. Next is social, cultural. Initially, we have a lot of different NGOs, the way we remove strays from the street, and our way of rearing dogs, I think culturally is different in a lot of our community. Dogs are part of their family. In the log houses, they are sleeping together in the veranda, the log houses, and in the rural community, dogs are used for hunting, so they value a lot their dogs. Sometimes we had a hard time convincing these dog owners that have dogs for hunting that vaccination of your dog won't impair their hunting ability. I think we have tried to convince them, but still some of them refuse to have their dog vaccinated. Of course, for that, responsible pet ownership is one of our problem also. We have instances where we go for house-to-house vaccination. We want to vaccinate the dog. They say, we have no dog in the house, but we can hear the dog barking at the back. There are instances where there are rabid dog that chew off the sofa of safety, and the owner of the dog have to be outside. The dog are inside the house, the owners are outside. So this can happen. This also happened during the earlier part of our campaign. Next. So these are the challenges mentioned many times. Okay, I think we can mention there. See. Earlier I mentioned about lack of manpower. I think that's still happening. We're trying to get more people to assist us in vaccination. Data, we don't have much time to collect data except for those that we receive from dog bites vaccination. Funding, every year we have to bid for it. Difference from next slide, animal rights people, lack of awareness on rabies. So these are challenges that we see now on the ground. And of course, awareness, education is still important in our fight against rabies because we need cooperation from everybody. We need cooperation from dog owners. We need cooperation from those implementers, removal of strain. The way forward, I think this is part 5 of my presentation. Now, the state government actually, because of our porous border with Kalimantan and Borneo, they have actually recruited close to about 179 of them. 79 of staff. Okay, I think. Okay, these are the people, we call them immune belt enforcement team, that will police the 1,200 kilometer border with Kalimantan. So my time is coming up. These are awareness program, targeted removal of free roaming dogs, identification, registration, vaccination, surveillance, data management. Next. Okay, responsible pet ownership, right? We have to vaccinate rabies annually. Don't roam freely. Neuter your pets. License your pet if possible. Okay, that slide shows from one breeding pair you can get close to 60,000 dogs if nothing is done. In 19 generations, you can get that many dogs. That's how fast a dog can multiply. You remember gestation period in dogs is only like 60 days, so they can breed a couple of times a year. Next. These are the interagency collaboration under One Health. Okay, we have council, we have SSPCA here, we have the Sarawak Veterinary Association. Okay, Sabah helping us, DVS helping us. Next. These are pictures, that come here. One Health approach, engagement with various sectors. We also have community policing that we are doing now to help with our rabies control measures. Next. Okay. One Health approach again. Next. Next, we have wolf run, we have rabies run. We have a lot of activities to make people aware of rabies. We have talks. We have talk we've been interviewed by radio, by RTM, all platforms. Next, this was Sare just now mentioned. I think Dr. Katinka also mentioned this slide just now. Then these are the things we need to impute before OIE will consider rabies freedom status. How sustainable is our program that we will not get rabies after the freedom status? Like For example, some countries, once they got their freedom status, but next year they get rabies again. So this is what is not sustainable. So it has to be sustainable, that there are no source of incursion, that our neighbors are still free before we can actually be confident enough to say that we can be rabies free. Next. In conclusion, mentioned earlier, our journey towards rabies free states. Next. Critical success factor, mentioned along the way of my presentation, community engagement is very important. And we have to train people to be motivated to control rabies, and eliminate rabies. Next. Okay, why we need to end rabies? Of course, rabies kill, but it's highly preventable, right? And we have the tools now to eradicate rabies. We have, although it's fatal, but then it's still, there are 3 proven measures that we can get people from not dying from rabies. One is awareness. We have PEP, and of course we have a mass dog vaccination program, that if we have dogs in this country but they are not harboring the disease, we can end rabies. Mentioned earlier, rabies affect the most vulnerable population in Asia and Africa, and in children. And of course, last but not least, we have this tripartite One Health approach, including the Global Alliance for Rabies Control. These are all the 4 agencies that have the aim to prevent, to end rabies by 2030. I think that's basically my end of my slide. Okay, thank you.
Thank you, Dr. Stephen, for the extensive presentation and for sharing his work and experience, as well as the strategies elicited to eradicate rabies. So it's nice to see in the chat box, SPCA Sarawak is engaging with the audience, and also to provide, and also by providing the ongoing collaboration. Okay, so just a brief update. We have 98 participants in WebEx, and that's roughly around 95 from YouTube. Please don't exit the meeting yet, as we are arrived for our Q&A session. So I would like to pass the baton over to my friend Zeline to conduct this session.
So hello guys, now we have finally come to our Q&A session that everybody is anticipating. So now I will read out some interesting questions from the chat box, but due to the time constraint, we might not be able to answer all of the questions. I will try my best to ask as many questions as I can. So there's one interesting question directed to Dr. Katinka about the oral vaccines in Thailand. So can oral vaccine cause rabies symptoms in animals? And can children get rabies symptoms if they come in contact with oral rabies vaccine or ingested it?
Okay, thank you very much for the question. It's a very good question. But clearly, before a vaccine, an oral vaccine get licensed, there are very, very rigorous procedures to follow, yes, exactly to ensure that the vaccine is safe. Therefore, nowadays, these are mostly genetically engineered vaccines, so that only one part of the rabies vaccine is kind of used to induce immunity. Therefore, the vaccines, there needs to be assurance that neither the animal excretes the rabies virus that is viable, or that people that pick up the baits, that they could get in contact with the virus. So therefore, there are a lot of safety requirements, and this needs to be ensured. Just to mention also the delivery mechanism of the oral rabies vaccine. It's not like what was done with foxes in Europe in rural areas, where it was left in the environment, that these were partly distributed even by airplanes. But the dog rabies, oral rabies vaccine is hand delivered. So you will actually give it to the dog that is nearby. And then when the dog doesn't take the bait, you take it away again. Or if the dog leaves something that he hasn't finished completely eating the bait, then you would also remove it for the environment, especially to reduce as much as possible the contact of any also other animal species or people with the bait. Thank you for the question. Over to you.
Okay, thank you, Dr. Katinka, for the clarification. Now, I would like to read out a question for Prof. Razita. So, since rabies has been in Sarawak for more than a year, do you think there are more awareness now among the Sarawakians to prevent rabies? And also, how does increasing fear about dog rabies impact public perception of dogs and animal welfare, especially in medities? So can we have Prof. Razita to answer this question?
Yeah, thank you for the question. Actually, in terms of awareness, we did a simple study on knowledge, attitude, and practice in our positive area in Samarahan. And what we found is they know about the disease. They know what is rabies, and they know what to do. For example, like if you get bitten, you do directly hand washing. But the one that they did not know is where is the positive area. So even if they stay in positive rabies area, they are not aware that their area is positive. So that's why I in my presentation, so the fear is not there because their assumption is their area is not a positive area. So those are something that we should take note. And in our project under the Healthy City project, the community leaders that engage in our project, they agreed that the area positive rabies should be made known to the local community, maybe by having poster or whatever. So that is what they suggested. Yeah. And what is the second question again? Sorry.
The second question is
Public fear, is it?
Yeah, public perception of dogs.
Okay. So actually, if normally human beings, when you know that you are at risk of getting the disease, that means the fear is there. So definitely you try to avoid in contact with the dogs. So those are the main important. And we know that even though for Muslim, not only for Muslim, even for the non-Muslim, if they know that their area is positive area, definitely they will not do activity which make them close to the dogs. So those are the fear factor which important for us to instill in our community. Okay, thanks.
Okay, thank you, Prof. Razita. So I think that like fear factor is also a very important factor for us to protect ourselves from rabies. And I got another very commonly asked question is about the transmission from wildlife, especially from bats to dogs, since like bats are the main reservoir for rabies. So Dr. Katinka, can you first answer us regarding this question about controlling the wildlife?
Yeah, as you have also seen from the maps presented, that in the Southeast Asia region, mainly the dog is the one that is transmitting rabies. If we see, for example, in South Asia, there is Sri Lanka and Nepal, they're, for example, reporting that rabies is also being found in jackals. And if we look at the risk for humans, we will find always that it's the dog who poses the greatest risk for the transmission of rabies. So therefore, even if you find some cases in wildlife and also in bats, in the type of bats that circulate in this part of the world, the risks are very, very low. This is different than the bats in Latin America, which is a different type, and these are the so-called called vampire bats. And these are blood-sucking bats, so they attack livestock, but also people at night. And people often don't feel that they're being attacked because they have like an anticoagulant and a kind of an anesthetic. And often people are bitten either on the lips or on the toes. These are the areas. So then clearly it's a different issue and different way of tackling it. But I think for the region in Southeast Asia and specifically Malaysia, I think it's important you concentrate your resources on rabies control in dogs. Thank you.
Thank you, Dr. Katinka. I would like to direct this question to Dr. Stefan too, to share about the control of wildlife in spreading rabies, especially in Sabah and Sarawak.
Yeah, control. Can you repeat the question again, please? Control
Of the transmission of rabies from wildlife in Sarawak.
Okay, thanks for the question. As mentioned by Dr. Katinka just now, we do conduct some surveys that even some bats dying in the hospital compound in Syria, and we do sampling, but so far they are negative. Now, our bats in this part of the world in Sarawak, they're actually they're not vampire bats; they are fruit-eating bats. So they don't bite animals or they don't bite human. Apart from that, the other wildlife that are probably like about carnivores, the mustang and all this, I think they are very they are not within the human population areas. They may be in the deep jungle. So chances of human being ever bitten by this type of wildlife, like foxes or whatnot, in fact, almost negligible. Okay, so answer your question?
Yes, Dr. Stefan, thank you very much. But this brings us to another question. Since Doctor mentioned that there are constant and intense surveillance for rabid dogs and vaccination program, and just now you said that current pandemic has really impact on the mass vaccination that you guys have been doing. So are there any other approaches, or like if you found out that this owner that having rabid dog that without vaccination, like what action do you guys actually do towards this population?
Okay. Now there are still plenty of dog owners that still refuse to have their dog being vaccinated. Even when we go for house to house, even very intensively, there'll still be like 10 to 20% of them still refuse to have their dog being vaccinated. But I think starting this year, I think we'll be more strict on that. We are going all out because we have enforcement team now. Those that refuse to have their dog vaccinated, they actually can be compounded. They can be fined for not having their dog vaccinated in a disease-infected area. So there's already a vaccination declaration that that area is rabies infected. All dogs in that area declared as rabies infected must be vaccinated. Failing to do so, they can be subject to compound or fine.
I see. So thank you, Dr. Stefan. I hope that the enforcement is good enough for rabies prevention. And now we come to another question, which is about the just now mentioned by Dr. Katinka also, that the vaccine dog coverage is about like 80%, 70%. So there's a question regarding like how do you guys know that the vaccine coverage is actually that percentage, and do you guys have the total population of dog of particular region that you guys vaccinate? So can Dr. Katinka answer this question first? I think this is related to the DIVA also.
Yes, thank you. Well, estimating dog population and dog population coverage is clearly not an easy task. Normally, when you vaccinate a dog, you will give it a collar or you mark the dog, and that will be enabling you immediately after a vaccination campaign, for example, counting the number of dogs that, for example, are on the street, and to see which ones are collared and which ones are not. This is especially also when, for example, free roaming dogs are being vaccinated. And here giving, for example, the example of Bali, where all the dogs were being collared and then afterwards you do a recount. There are different methods to estimate the dog population. And here, for example, it's always recommended to do some short dog ecology studies. And in that way, you can understand better. And I think also here the CAP studies are helpful. On the one hand, determining the number of dogs in a household, and then to also determine, how accessible they are and what are the perceptions of the people living in the household. But certainly to mark the dogs, that's an important part so that you can afterwards count them. Just mentioning on the dog ecology study, it helps you to kind of estimate the dog population. And you might need to use, rural areas and urban areas have different ratio, and then you can extrapolate and more or less estimate the dog population. And then with the colors and the marking of the dogs, you can see how many have been vaccinated, or from your vaccination records. Then you can kind of see how many is the estimated dog population and how many are the ones that have been vaccinated. But often these figures are not always reliable. We have seen, for example, in Bali that then certain areas have vaccinated 120%, which is not realistic. So then there was a problem with their denominator. So this, you have to readjust your numbers. Thank you.
I see, Dr. Katinka. Thank you again for the clarification. And now this directs me to another question, which is there any compulsory or enforced vaccination regime given to individuals in red zones, such as pre-exposure prophylaxis? This question is directed to Prof. Razitasham. Thank you again for the clarification. And now this
Okay, thank you, Go, for the question. Pre-vaccination, by right, we should give to those high-risk staff who work in positive areas. So I only can mention that. Yeah? So by right, it should be given. For example, like the veterinarian who work directly in the area of rabies area should have pre-vaccination given. But it's all depend on our ministry. But maybe Dr. Stephen can add what is the current situation now, especially to our veterinarian who work in the positive area. Okay.
Thank you, Prof. Most of us who actually involved in rabies control, even from the driver up to those catching dogs as well as those handling dogs, all of us actually are given the PEP, post-exposure prophylaxis. All of us. Those that are new joining us, even then we also arrange with the medical department to have them vaccinated, fully protected before they go out to the field. Otherwise, even those council people who are catching dogs, they are all protected. They are all given pre-exposure prophylaxis. They have to be vaccinated before they are allowed to actually go into the. I just want to take off from where Dr. Katinka mentioned about denominator in the dog population. I think in Sarawak, particularly in Kuching, it's very. We don't have time to do actually a real dog count. We have estimate from all the division. And during our that time during our ops rabies under NATMA, like was mentioned, we vaccinate more dogs than what was actually seen by the people in the particular area. We have people who actually started to tell us there are so many dogs in a particular area, but when we do vaccination, there are more. Of course, sometimes when we go to an area, if we go, for example, to do vaccination in the afternoon, the dogs will be in the farm with the owner. They only come back in the evening, and by that time, those vaccination people will have gone back. So we have to do another like mopping up exercise to vaccinate those dogs at night in the log houses. Okay. Also, as mentioned, it's very difficult to tell about how many strays we have, because like in even Kuching, like a big city like Kuching, they have a lot of vacant land, where between housing estates, there are shrubs, there are bushes. These are where all the dogs whelp their puppies. Then you see them at night coming out with they don't come out with a puppy, but they come out that they are already whelping their puppies. So there are puppies actually in these vacant lots, in these bushes, brushes. So very difficult to do actual, I would say even 80% estimate of a dog population in an area, because it's just impossible in that area. I see Donna there. She's very close with us from SSPCA. She can also vouch that it's very difficult to do how many strays we have actually in Kuching. Even own dog also, not many people, not all of them have their dog vaccinated. Thank you.
Okay. Thank you, Dr. Stephen and Prof. Razita. And this, I have another question about reinfection of animal that have been vaccinated. So what do you guys recommend to do? Like, if you guys have already vaccinated the area, but there are reinfection. So is the statistics still the same, or you will do like checkup on the area after vaccination? So maybe Dr. Stephen and Dr. Katinka can answer this question.
Maybe I start first. Okay. When we do our vaccination program, even after vaccination, some dogs don't take up the vaccine for reason that they are immunocompromised or something like that. That's why we need to have, ideally, we should have a booster a month or so later, but because we are doing like annual vaccination, we only consider if the dog has been vaccinated more than a year or about a year, then we revaccinate. That's a booster vaccination. You can see, like in human, we have to do like 3 or 4 shots before consider yourself really protected. Likewise, in dogs, maybe one vaccination may not be suffice. We have a lot of cases, instances where after vaccination, they still come down with rabies because they're already incubating the virus. So our vaccination is it's not helping at a particular point in time because they're already incubating the virus. Okay, maybe Dr. Katinka can help.
Yes, no, you're very right. And also sometimes what you see, like for example, in Bali, what we did was after the vaccination campaign, you go back to the area to go what is called the mopping up, because some dogs have been left out of the vaccination, and also after some time you get the new puppies coming in. So to also focusing on the puppy vaccination. Also often on the label of the vaccine, it said that puppies under 3 months should not be vaccinated. We, however, recommend to vaccinate any puppy that you come across, no matter what age it has, because most likely the mother will not have been vaccinated, especially if the disease has been introduced quite recently. And second, many of the people, especially children, they play with puppies and they are quite a big risk then to transmit the disease. What we also have found in some countries, like for example Tanzania, that female dogs abandon puppies when they have rabies. And that's when people go and they find these puppies and then, take care of them. And these might be a heightened risk group. Dr. Steven, very interesting what you were saying on the timing of vaccination, that you find you have to adjust your campaigns to the habits of the local communities. What we found in Africa was that mainly young boys are the ones taking care of the dogs. They are the ones knowing how to handle the dogs. So Therefore, when the vaccination campaign was being conducted during school holidays or on weekends, when these young boys are available, we saw a big increase in the vaccination coverage. In that way, targeting also the public awareness to schools and school children, because they were the one bringing the dogs. So thank you. Back to you.
Thank you, Dr. Katinka and Dr. Stefan, for answering the question. And I got another question is more regarding to the human health. So how do you actually detect latent infection in humans if they are not really aware, like they got rabies and they are not like going to the hospital to get vaccination after the bite? Or so Prof. Razita?
Okay. So actually, it's difficult for human rabies during the latent period. Our lab will be negative. It's only when they develop symptoms, only then we can detect the virus. So actually, during the latent period, there is no way we can know that that person is infected. Yeah. That's why if you look at our cases, for the initial case, it was initially diagnosed as encephalitis. Yeah, but even based on the clinical symptoms, because in Sarawak we are more of Japanese encephalitis, so we had that diagnosis first. Yeah, but during the incubation period, whereby you have no symptom at all, so you will not detect any positive based on the lab. Okay. Thank you.
Is it meaning that if the patient should be positive but detected negative, then there will be because there are no disease detected, so they will be not be treated?
True. Yes.
I see.
Yeah.
Okay, thank you so much, Professor. And there's a question related to this. If there is like clinic manifestation that appear after years in humans, so is there any latent infection in dogs? Like, is that possible? Dr. Stefan, this question is for you.
I think you need to repeat the question again, Go. For Dr.
Yeah, sure.
Stefan? Yeah.
Dr. Stefan? Okay. Okay, I'll repeat the question. So, is there any latent infections in dogs? Since human can get latent infection, is that possible in dogs? And how do we detect?
I don't know what you mean by latent effect. I mean, dogs could be harboring the disease until they show clinical sign, like I mentioned earlier. Incubation period usually is within a month, but some can be as long as even 6 months to a year, depending on the virus load, depending on where it was bitten. Like probably mentioned, if you are bitten at, for example, even in humans, if you are bitten at the leg, for example, it will take probably months for the virus to reach the brain, because I read literature that say it moves about 1/8 of an inch a day. So through the nervous system. You know, our nervous system is quite long before it reaches. So latent period, or we call incubation period, not show any sign until even if after they reach the brain, until they reach the salivary gland, then they become ferocious. And then also there's the paralytic rabies, which occurs in about 20% of the cases. Not aggressive, the dogs, but they are still rabid, and they can transmit the rabies virus to human when the humans are being bitten. But there are 80% of rabies are actually the furious type. That's where it's easy to that dog is rabid, but there's still like 20% that are not obvious a rabid dog. But as regard to latent infection, as long as they're incubating, if it hasn't reached the brain or to the salivary gland, that the virus will not be spreading yet.
Okay. So how to detect? Since some of the dog will not be showing clinical signs, even they are infected with rabies, how do you detect the rabies infection in these dogs?
Of course, when they are still moving up the spinal cord until the brain, even even before it goes to cerebral, we can still detect rabies inclusion bodies in the sample, brain sample that we examine under DFAT. What we'll see, spots here and there are not very obvious, that then become, in our diagnosis, we may say mildly positive. But if they are very rabid, you can see in the brain that you can see that it's very, very positive. There'll be inclusion bodies all over. But unless the virus has gone to the salivary gland, that's where it won't be infective unless they bite the person. You need a bite. You need a bite to transmit the rabies virus.
Okay.
The virus is in the saliva.
Okay. Thank you so much, Dr. Stephen. Dr. Katinka, would you like to add up on that?
No, I think it was well covered. I think, also some dogs, they might die without showing any symptoms and be positive for rabies, but that would be then the silent form. I think maybe another issue to take into consideration on human cases, that if people do not finish the post-exposure course, what has been seen, and this has been reported from India, that people might recover from rabies, but they might have terrible sequelae afterwards, or that they might still survive for longer. So therefore, it's also very important that people receive the whole course and do not finish earlier in case the dog has been found as rabies. Just to mention that. Thank you.
Thank you so much, Dr. Katinka, for the additional information. And now we have come to a question that most animal lover that will ask, because to detect for rabies diagnosis, we can use saliva as a good sample, but confirmation through saliva sample is not conclusive at times. And one way is to use the brain sample of the animal, which works very well, but that means putting them to sleep. So are there any current effort to find like new diagnostic methods to do animal rabies diagnosis? I think Dr. Stephen and Dr. Katinka can answer this question.
I'll leave it to the expert. Dr. Katinka, I think to me, it's only the gold standard is to detect rabies virus in the brain. Other than that, I think it's not possible. It won't be any positive cases. It has to be in the brain.
Yeah, there is some discussion on that, and please, I'm not a lab person, but there is some discussion that, for example, with PCR, that might be a possibility with saliva, but it's still not recognized by the OIE as the gold standard. It's still the immunofluorescent that is, and the DRIT. These are the two tests that are kind of confirmatory. But I think with new technologies, there might be new advances and different ways of diagnosing. So let's see, hopefully there will be a possibility where you don't need to euthanize the dog and take a brain sample. Thank you.
Thank you so much, doctors. Okay, so I've come to my last question, which three doctors and professors have mentioned that actually porous border is actually the main problem of rabies spreading. So what can we do about it to have more control on our borders? And also how to raise awareness to the public that rabies is causing a health problem to our society. So maybe one of the doctors can start answering the question first.
I mentioned earlier that this, because of even if we had gained freedom status, and if our neighbor is still not clearing themselves up from rabies, there's always an incursion, like what happens in 2017. As I mentioned earlier, the dogs are moving in and out of the country without passport, and of course, what we are trying to stem this is that the state government actually is coming up with this immune belt enforcement team. These are dedicated office people. These are dedicated officers that will carry out vaccination in this border area. They'll be doing surveillance. And of course, dogs that are vaccinated in this area, they will probably be identified, maybe a dog collar or dog tag. And then we see how many dogs that are not vaccinated coming through. But of course, we would like also the other side to do similar things, but I think they have constraint there. Okay, thank you.
Yeah, maybe if I just may to add to that, I think Dr. Stevens said it very rightly. It needs to be cross-border. Both sides of the border needs to collaborate. For example, what we see between Bhutan and India. Bhutan has been making a lot of progress in fighting rabies, but there's always incursions from the Indian side, and that province has not been actively promoting vaccination. So what actually Bhutan has done has been an agreement with that part of India, and actually it's the Bhutanese conducting vaccination in the area bordering the country to protect themselves. So I think here it's important the cross-border communication and to have, first of all, maybe the local communities or the municipalities or districts discussing, but also at government level. In the end, it needs to be between the two countries to have an agreement to protect each other and to collaborate. But this is something, you know, that needs a lot of political will. Thank you.
Thank you, Dr. Katinka. Dr. Razita, do you want to add on to that question?
I think at the border mostly the control on the animals, yeah. But on the human side, actually we can do much better, as what Dr. Stephen and Dr. Katinka mentioned, that the two countries actually work together at the border area. So that is actually the most effective strategy. And I remember in one of our during our EIP, during one of our field epidemiology training, we invited the Indonesian EIP. And actually one of his suggestions is actually at the border, it must be a joint activity between, for example, in this case, between Sarawak and Kalimantan. So that can be more effective. Okay, thank you. And definitely we cannot miss the local people at the border. So they need to know that rabies is there, and rabies actually very, very harmful to them. So that is a message that we need to inform the public, because what we noticed even in Sarawak at the border, where during our risk assessment, that village, that local village, is actually a high risk to get the infection from the bordering site. But even it did not translate. This message did not translate in the behavior of the local community. It seems that they did not appreciate that the rabies will come to their village. So that is the important thing, that we should inform the villages which has the high risk country. That's why I said it must be a targeted approach to all these borders, the village at the borders. Okay, thank you.
Thank you so much for the clear answer. I think more efforts have to be done, especially from all the authorities and public awareness. So now I've come to the end of the Q&A session. Sorry if your question is not answered because due to the time constraint. And thank you for asking all the questions and interacting with our speakers. Now I would like to pass back to Saji for the ending.
Thank you, Zilin, for moderating such a fruitful session, and also for the speakers for elucidating the important key points involved in rabies spread and control. So that now that we've reached the end of the webinar, Prof. Latifah, would you like to say anything for a closure?
Well, thank you so much, Saji. I think this has been a fantastic platform of discussion. Amazing questions by the participants, so much interest. I hope you have learned as much as I have. I certainly have learned a lot today from our eminent speakers, Dr. Katinka, Dr. Stephen, and Prof. Razita. Thank you so much for sharing. Just wanted to congratulate IVSA and One Health Student Club. I am very, very proud of you, and I think more students club should be doing this. Definitely something that is very fruitful, and I think will be enjoyed by students. I mean, you learn so much from organizing activities such as this, not just like communication, but also like information that you get is very real time, and you get the most from experts in the region. Thank you again. So over back to you, Saji.
Okay, thank you, Prof. So before we wrap up the session, I'm just going to share the QR code. So should any of you require e-certificates from us, do not hesitate to fill up the Google form that we will also provide in the chat box. So thank you once again to Prof. Latifah and our guest speakers. On behalf of the organizing committee, I would like to apologize for any shortcomings throughout the planning and execution of this program. We hope that you would continue to support us in our future events. With that, this is Jida, and I'm signing off for today. Till next time. Thank you.
Okay, thank you so much. Bye-bye. Thank you.
Thank you, everyone. Bye.
Thank you. Bye.
Thank you.
Thank you, Doctor.
Thank you.
Thank you, everybody.
That was very
Have a
good talk.
nice
Thank
day
you.
ahead.
Well done.
Have a good weekend.
Have a nice
You
weekend.
too. Everyone, have a good weekend.
I don't know. That was a job.